in before it's too late. Okay, so I guess no one has any questions. So before now, this will be posted. I hope you all have a chance to look at the presentation because I posted it this afternoon. I wanted to give you all the opportunity to kind of look at it before I present it today. As I mentioned, we'll be covering directional strategies. Today, the objective is to be able to understand the role of and the relationship among organizational mission, vision, value, and strategic goal, and why they are called directional strategies. To also be able to recognize the important characteristics and components of organizational mission statement and be able to write a mission statement. So we'll kind of talk about the components of different, the components of a value, the components of a mission, the components of a vision. So you'll kind of know the different components of each. So like whenever you are writing a mission, vision, or value, you'll know what are the ingredients that adds to it or that makes a good mission, vision, and value for any organization. Another objective is to recognize the important characteristics and components of a vision and be able to also write that for an organization. Same for value. Be also be able to know the components and be able to write a good mission, to be able to write down what is a good value for an organization. Also recognize the important components of a strategic goal for any organization, and also be able to write one. Identify different service categories critical to a success factor. Develop a set of strategic goals that contributes to the mission and also move the organization towards the realization of its mission and as it consists with the organizational value. Finally, to recognize important issues in governance of healthcare organizations and roles of the board of directors in maintaining policy making directions. So now, developing a strategy. So last week, we've kind of covered this a little bit, especially this diagram. We talked about the external environment. We also talked about the internal environment, but what we don't talk about is the directional strategies, what goes into the directional strategy. So external environment is what we should do. The external pressures that come from the external environment kind of add to what the strategy of an organization should be. So that is like the expectations from the external environment, the external pressures, whether it's from the competitive aspect of the market, or whether it's like, you know, the market pressures that requires an organization to cater to its environment. And the internal pressures is also looking at, you know, the what we can do from the internal. Basically kind of looking at your resources, what you have as your resources, and thinking about, okay, we have all these resources, what can we use it to do? So that is your internal pressure. And then your directional strategy coming from your leadership is basically, you know, the mission, vision, and value that is something that you stated that is your organizational identity. That is what it should be all about. You have it there, you stated it, you have it written everywhere, your websites, that's what people know you as. But now you have to generate a strategy to kind of, you know, to put those mission, vision, and value into action. So your strategy is usually what gets you there. So it's like your plan, how you intend to get there. So your directional strategy kind of, you know, is something that you have written somewhere that, hey, this is what I intend to do this year. This is what I envision that my organization, or that this is what I envision. This is my mission. This is my objective. This is what I want to do. Then, you know, then from there you can kind of start putting things together. Start planning around that and also measuring that to be able to accomplish that. but also your external environmental pressures and your internal environmental pressures add to that. Kind of those tend to enhance what you want in general, but always you should always have a vision and also a mission that kind of drives everything you do as an organization. So that is the strategy of an organization. So when you are doing your strategic planning, you've done, your situational analysis, which you've done your external analysis and internal analysis. Now you have to craft a mission, vision, and value. So that is also in terms of part of the analysis that you do, because you have to really analyze and see what your organization is all about, what you want your organization to be. So that requires a lot of thinking, what you have done in the past, what you want to do in the future, what you have in your arsenal to get you there, and how you envision your organization to be in the future. And then doing that requires a lot of research, a lot of looking at your market, looking at your internal and external, and kind of coming up with those important statements. It can be just one sentence, but it represents the identity of your entire organization. So it requires a lot of work, a lot of energy to come out with that single sentence that states everything about your organization. Okay, so now the directional strategy gives an organization its identity, like I mentioned. It represents who we are, it represents where we are going, and how we work. So basically, when you have your mission, a mission kind of clearly articulates what the organization currently does. So that's basically, if your mission is to, as an organization, is to serve a community, serve the underserved. That can be your mission, like to serve the underserved, serve mankind. That is your mission. So that is what your organization is all about. Then your vision articulates what the organization collective hope for the future is. Their vision might be to be able to, it can be a very broad statement, but it kind of articulates what you are all about as an organization. It's in terms of stating a vision of an organization, it's like, kind of, when I'll kind of say, when we decided to, the United States decided to kind of land in the moon, a lot of people think it was impossible to land in the moon when that statement was made, but that was a vision. If you say that, your organization will have will serve 100% of this community in the year 2030 or something like that. That is the organization right now might have 30% of the market share, but you want to have that vision that by the year 2030, your organization will have 100% of the market share, will be providing 100% of the underserved care in this community. That is a vision. That is something that you intend to do. You are serving 30% of the underserved of this community right now, but in year 2030, you want to have 100% of, you want to serve 100% of the underserved in this community. So I'm kind of looking at it from the underserved community, because when I think about it, I always think about healthcare in the sense of public health. I'm always looking at the safety net. So that is why I'm talking about the underserved community. But if you want to also look at, okay, you want to take a market share of 30%, you are now covering 30% of the surgical procedures in this community. You want to gain 100% of that market share. That means everyone that needs surgical services will come to your hospital. That is also a vision. Your value, it describes the behavioral norms, the behavior, the ideals, and that are important to your organization. So if customer first is the behavioral norm, or the patient-centeredness is a behavioral norm, that is the value that you share. You know, like if your value is also is always quality comes first. Everything that you do as an organization have to be state of the have to be quality has to be at the forefront of that. So that kind of drives all the activities within your organization. So the values that you hold as an organization is also stated there as your value. Everything that you do, whether it's patient safety is part of your quality, customer service, patient first, patient centeredness. If your value is to maximize profit, then that is your value. So everything you do, profit, making profit for the stakeholders has to come first. If your value is to if your value is to cut cost, then everything that you do as a behavior with regards to if you have to turn off the lights, you train your staff to always turn off the lights when they leave the office, etc. So that kind of, once you generate that behavior in once your staff build that behavior, so that kind of drives reducing your energy savings, improving your energy savings, and reducing costs you spend. If your value is to reduce the amount you spend in papers making copies, then basically you advise your staff to make copies on both sides or recycle paper, etc. So that kind of goes into their into the behavioral norms they have, or the beliefs they have, or the ideals, is to cut costs. So that is, some of the value, some of the things that kind of goes into values, but it kind of drives what you do as an organization in general. So mission, vision, and value of an organization are central to the strategic planning process. All the strategies and the goals must support the directional strategy. Strategy rich. So in terms of strategy, the directional strategies outcome. So you reach a consensus and and then you document what the organization currently does. You reach a consensus and also document the collective hopes for the future. You reach a consensus and codify the fundamental values. Those are the three strategic, the directional strategies outcome that you would like to have at the end of this exercise. You want to be able to say, okay, what do we currently do as an organization? What do we hope to do in the future, or how do we see ourselves in the future? And then you can say, okay, what is the values? What are the fundamental values that we have that is rudimentary to our organization and will get us there, and we don't have to compromise on that. But if we continue what we are doing, we'll get there without having to compromise our identity. So those are the three things. What are we currently doing? What do we hope to do? And what is rudimentary to our organization? What is true to our organization that if we continue to do, or if we codify that particular behavior, we'll get there. Like I said, if you want to cut costs, you say, hey, right now we are spending so and so amount of dollars, and we'd like to save so and so amount of dollars in the next 5 years. Then you adjust your behavior, you adjust your fundamentals to get you there. So that is the three things that I would like to take away from this chapter. The vision is the profile of tomorrow. Our hope for the future. The mission is the profile of today, our current products and services, customers and philosophies, and our values are the profile of expected behaviors or beliefs and ideals. Any questions so far? Okay. All right. So now we move. So what we want to do, that is our mission. An organizational mission is broadly defined but relatively enduring statement of process that distinguish an organization from others. So an organizational mission sometimes you might run into organizations that have very similar missions, but then again, they have different values and also different visions. So, sometimes an organization might have a very generic mission to, serve mankind or something like that, or to be the best service provider, that ever was, or something like that. But it's a broadly stated statement that encompasses everything the organization is all about. So it's very clear and concise. Like I said, it can be like 3 or 4, maybe like 5 words in a sentence. It's really something that is very catchy. You see it in the logo sometimes. You see it in the in the web page. You see it in the about the organization or something like that. So it's a very short and concise statement that is very clear, that encompasses the values, that is very, very broadly stated, that it encompasses everything the organization is all about. It concerns with the organization of today. So it's specific about the products and services. It's very enduring, meaning that it carries over. It can last for a few years unless something changes, the organization decides to shift its mission. But it's something that, when the organization was first formed, it was something that the founders had in mind. When they say it's enduring, it can last for a long time. It usually originates from the founders and endures through time, whether it's, things are going well or it's not going well. It's what the organization is all about today. And that is what represents the organization today. It underscores a uniqueness. So basically it's the identity of the organization, which kind of sets it apart from other organizations around. It's a broadly stated statement, but again, it's a very unique statement. It doesn't necessarily have to be very, it can mean, for most organizations that provide the same services, they can mean the same thing, but differently stated. Okay. So the mission for strategic, so now strategic thinking map for writing a mission statement. These are some of the components, things that you should keep in mind. So the components of a mission statement is that it usually targets the customers and the clients. Like I said earlier, your mission might be to serve the underserved population, or basically to serve mankind. To serve mankind, you can say, your mission is education, service for mankind, etc., something like that. As an academic institution, your mission might be quality education and service of mankind, and medical services to the underserved or the safety net population or something like that. But this is just a very it's an example I'm giving you. It's a very crafty mission statement, but like I said, mission statement is not crafted in a whim. It's something that you really have to think of before you actually put it down. But I'm just giving you an example. So it targets the customers, it targets the clients. So basically, who you are serving. Like you have a hospital like MD Anderson. So their mission might be to eradicate cancer forever. So who are they targeting? They are targeting the cancer patients. When you have a statement like that, it's what they're all about. When you have a mission statement like that, it's what they're all about, curing cancer, and that focuses on a particular group. The principal service delivered, MD Anderson again is, eradicate cancer. The service is to cure cancer. Every service, everything is all about cancer. So that's their principal service. Provide college services, provide anything provide services to cancer patients, things like that. Geographical region, so the geographical domain of service delivered. Sometimes this might not come in the mission statement, but they will not explicitly state that they will provide services to this geographic area or something like that. So sometimes mission statement might be a little bit in terms of stating the explicit that will provide care for this region, or we are number one for quality in this region. We are number one for quality. We are number one for patient care in this region, or something like that. To be number one, but that's like more on the vision side. But in terms of geographically stating the domain of the service delivered, some mission statement might include that, but most of the time it's a very concise statement that kind of state what the organization does. But sometimes it might also include the actual market in which for which they serve. It also specifies the value of the organization, and then explicitly state the philosophy of the organization. So, when it comes to, service, or when it comes to, being the provider of a particular service, or being a provider of a particular product, their philosophy, the mission statement covers basically the philosophy of the organization, and also state exactly what is the fundamental of that organization, whether it's quality, whether it's whether it's quality, whether it's patient care, etc., or providing access to healthcare services or something like that. It has to specifically state that philosophy, how they look at their service, and how because it also drives what is the mentality within the organization, being the best of everything. So it drives, being number one at everything. It drives the philosophy of the organization. So once you step into the organization, you would know that is what they are all about. So once you are within the organization, you get that. We are the best. We are number one, and that is what we're all about. Is either that or nothing else. Other important aspects of the distinctiveness or the image of the organization, so that is also included in the mission statement. And the vision is an important expression of hope, a description of what the organization will be like when it's successfully fulfilled its purpose. So the vision is inspiring, it's challenging, it's all about excellence. It empowers the employees first and the customers second. It comes alive in detail, not in broad generalities. It's okay. It's memorable and provides guidance. It's not limited by the present. So in terms of the vision statement, it clears in terms of having a clear hope for the future. So it's basically kind of, says what you are going to do. So when you say, I have a vision that in the next 10 years, we will have 3 or 4 different hospitals, or we'll be serving each city in this state. In the next 10 years, we'll have a branch in each state. That is your vision, because that is how you perceive. That is how you perceive your organization. So when I was in Texas, I did some work at Texas Medical Center, which is the largest medical center in the whole world. I did a lot of work for various hospitals there, including MD Anderson, Methodist Hospital, and other ones, as well as, University of Texas Health Science Center, which is where I went to school. So a lot of hospitals there, especially Methodist and St. Luke's, which is now owned by the Catholic Health. Also Memorial Hermann, they all, in terms of their vision, how they wanted to see themselves is to, especially St. Luke's. When I looked at St. Luke's strategic plan, I actually analyzed that strategic plan of St. Luke's as a grad student. So when they first crafted their first strategic plan, their goal was to have a hospital in all the major, have at least one hospital in all the major interstates in Houston, Texas, that connects to the medical center. So, in terms of when you build an interstate, everything kind of linked to the hub of the city, to the heart of the city. So they have interstates coming towards the hub of the city. So St. Luke's strategic goal was to have a hospital, at least an ambulatory health center, at least one at very close to the interstate, which will kind of link to the hub of the city. In terms of being able to achieve that, if you go into Houston, Texas right now, you see that the hospitals are very spread out, and you will always see either St. Luke's or Memorial Hermann or Methodist Hospital that is off the interstate of the major interstates in Houston, Texas. Whether you are going north or south, you'll always run into one. So that was their strategic goal then. That was one of their that was part of their mission, their vision in that time. But now, when you go there, you will see those things in place. But that was a long time ago, maybe in the I'm thinking in the 90s or early 90s or something like that. Maybe earlier than that. When the hospital was formed, it was way back in the 1960s. But they continued on with that vision, and they continue to build different hospitals in different interstates, close to different interstates. But that was the vision then. But now, in terms of how they are now changing their strategies and changing their goals, they are now looking towards, also some of them are expanding globally. If you go into the Middle East, if you go into Saudi Arabia, if you go into Dubai, you see hospitals such as the Mayo Clinic, you see Harvard, you see Kaiser Permanente, you see Methodist Hospital. So that's in terms of expanding their reach. You see all these different hospitals that are here, but they're also in the Middle East, like in Abu Dhabi, Kuwait, Saudi Arabia, United Emirates. So you see all these major hospitals here. They are also there, but in terms of the kind of services they are providing there, it might be a little bit different type of services, but mostly on the advisory capacity, they are providing services there. But this is part of being the number one on the global stage, reaching different areas and, being recognized as a brand. Okay. Now moving forward. So now it's also challenging, and it's all about excellence. It's inspirational and emotional, empowering employees first. Memorable and provides guidance. So your vision statement is memorable, and also it provides guidance. Like I said, it's what you, it's like that moonshot. States. In terms of when they say, hey, we want to land in the moon in the next couple of years or whatever, I'm not exactly sure, how long that was before they actually landed in the moon. That was a vision, basically the person who said that actually saw, the US spacecraft actually landed on the moon. So that's basically what, the person saw and decided, hey, we want to do that. When you are crafting a vision of an organization, you say that, hey, I want, to serve. I want a hospital in each city in this state or something like that. That is the vision. You envision, like, if there's 5 cities in that particular state, you envision to have a building that have your symbol or that have your logo in each and every city in that state. So that is the vision. That's how you picture it. That's how it comes up in your mind, and that's what you want to see when you think about your organization. So in terms of what we want to do, that is the value. So the value is the idea. So the value. So values are the ideals organization and people stand for, the fundamental principle that, along with the mission, makes the organization unique. So when it comes to healthcare, there are various there are various aspects of values that most healthcare organizations hold. And basically, those values are something that is very, very dear to the stakeholders as well as the patients they serve. Different type of business, different types of organizations, different types of products organization provide have different clientele, have different consumers. But in healthcare, it's usually the stakeholders, which are the community. It can be the policymakers, your board of directors, definitely, the patients. Those are the stakeholders, and what matters to them usually is, for the stakeholders or the board of directors, it's usually how profitable the organization is. The community is, the community leaders or policymakers is like, is the access, the community, people in the community, can they access healthcare through your facilities? The patient is the quality of the service they are receiving, the customer service you are providing, how they feel when they come into your building, the convenience. All those type of things. Those are the things that kind of add to the value. So I'm kind of, when I think about, kind of developing, when I think about values, I think about, Michael Porter is one of the key visionaries when it comes to, value-based care, etc. So he is a very popular, entity in craft and value-based care. So he was very into looking at those key aspects of value of healthcare, and also measuring outcomes from those utilizing those values. For myself, in terms of my research, I conducted research looking more into access to healthcare or access to services, which kind of adds to quality as well as healthcare outcomes. So that is what is rudimentary in healthcare or to healthcare organizations. Those aspects that kind of adds to the value of the organization, that speaks to the value of organization, how the organization connects to the community, and what type of services they provide to their clients or to the patient, as well as how the stakeholders, what the stakeholders hold there. So those things are connected. So it reflects the organizational culture, is consistent with the desired image, what the stakeholders see there as the organization, how patients perceive the healthcare organization. It's acceptable to the stakeholders, is very dear to the stakeholders. It is consistent with the vision. It's very, very ethical. And it represents a clear commitment of the healthcare organization. So the values are the desired behaviors. When you say that, we'll have, best in first in class customer service. So when you said that as one of your value, or you say that your patient always come first, your patients always come first, you are thinking everything that you do is all about your patients. When they first work in, the type of treatment that they receive will be memorable for them. That's what they will keep in mind. That's what they'll remember next time they think about visiting a hospital. So they will always remember that. So that is your value. Your patient comes first, and whatever you are doing, you drop when you see your patient coming to the hospital, you drop everything that you're doing and pay attention to your patient. And that is what it means, when you say, hey, the patient-centeredness we hold that dear. And when you say, quality it's all about quality when it comes to organization. It's all about everything you do, whether it's your patient safety, whether it's, having the best doctors, having the best nurses, having the best medical personnel in general. It's all about the quality, hiring the best. You know that the best will provide the best quality of everything. So you hire the best. Your mentality is always, the mentality that you drive in the organization is always do the best and always provide quality services, etc. So that is the desired behavior, organizational norm. You say, this is what, as an organization, this is what we are going to do. Honest, being honest, being cordial to our patients, and always. So you have certain organizational norm that speak volume to about your organization. Shared belief. That's as a value, something that you also have. If you are going to be a healthcare practitioner, you know that you are going to be caring. You have to be caring. You have to think about the patient. Everything you do is all about your patient, protecting your patient, etc. So that's a shared belief. Shared assumptions. Having hope. Providing that level of care that whenever a patient comes in, you don't speak everything that is in your mind, because you know that the patients are feeling a certain way, or they really have low esteem when they come into the hospital. So you want to speak hope into your patient, so that they will actually recover from their situation. So having that assumption that patient will get better once they see a doctor is something that you also want to relate to them, so they will have that in mind, that they will get better. So it's always having that assumption and also speaking those things to the patient so they will believe it. So that is an assumption that you should have as a healthcare professional. If you're a legal professional, you have a different assumption as a legal professional. So that also applies to that particular track. I have explicit, so the value also explicitly states the philosophy of the organization and also the fundamental principle of the organization. Critical success factors. So the critical success factors here are those things that the organization must accomplish if it is to be successful. They are similar to all members of the strategic group. They are critical. So they vary from one service category to another. There are usually 4 or 5 things that must be achieved. So there are usually 4 or 5 things that must be achieved for success. The strategic goals should address the critical success factors. So these are very few things that, in order to be successful, these are very few things that should apply. Strategic criteria for goals. So the goals address external issues, trends, or forces, concerns the stakeholders, help achieve critical success factors, draws on strengths or fix a weakness, fits with the mission, be consistent with the values, moves the organization towards the vision. So the goal statement criteria is, so the goal statement criteria is controllable by the organization, measurable as possible, able to achieve able to be achieved in a reasonable time frame and have a reasonable level of stretch for the organization. Process of momentum creation. So in terms of stating a goal, the organization, like individuals that have many goals, lose their focus. So that's one thing that you should have in mind. Also, what task created for successful conclusion is better than half-finished tasks. So this is something that came from the Forbes magazine from BC Forbes. This is where you're saying that, in terms of, having one thing completed is better than having a handful of, something that is halfway done. So actually getting one thing done is best compared to having nothing that is completed at all. So for most organizations, so 6 to 4 goals are the sweet spot. So they have, 6 to 4 goals that they would like to complete within that strategic sprint. So there are 3 types of goals. You have your input, you have your process, and then you also have your output goals. So action plans are developed for each goal. So basically your goal statement of goal. So you have your action plans that are completed. So this is something that you utilize as a worksheet in terms of developing your plans. So you have different columns here that you should complete. So you have action necessary to achieve the goal. You have also a time or a start time or end time. You have units, individual responsible for carrying out the action. You have strategic planning participants responsible for reporting at the next strategic section. Governing board, it's an important group that should be involved in the development of strategic direction of the healthcare organization, because they actually the leadership of the organization. So they should state how they view the organization, what the mission of the organization should be, and also they drive the value of the organization because they want to see the organization successful. So they are responsible for. So they are they are an important group in this exercise because they actually initiate the strategic exercise by formulating this key 3 key factors of a strategic exercise, which is the mission, vision, and value. So they state these things, and then the strategic management team then kind of take those things into action and then execute the strategic exercise. So the board members should be regularly informed about the goals, the progress being made in terms of completion. So once you have the board state what the mission and the vision and also the objective of the organization should be, their job is done there. So now you have a team that actually goes in and execute and then plan around those things and then execute the strategic plan in order. But during that time, the board, usually the CEO, usually inform the board of what is going on with regards to the strategic exercise. So the board members have the fiduciary responsibility mode or stewardship of assets. So they actually make the resources available, or they sign off on the resources, whether how much money should be invested. They actually commit on those things and then kind of give the leadership a go ahead, or the CEO or the vice president or whoever is responsible a go ahead to utilize those resources in executing the strategic exercise. Strategic mode, collaboration with management to develop a vision for the future. Generative mode, engage in shared creative thinking to make sense of the data available to decision makers. Progressive mode, so these are the 3 modes you see board members in, or the board of directors in. They are engaged in debating, discussion, and learning from each other. So 5 behaviors that leads to an effective board. So they engage in constructive conflict, especially with the CEO. They avoid destructive conflicts. They work together as a team. They know the appropriate level of strategic involvement. They address decision comprehensively. So managing strategic momentum and also evaluating directional strategies. You have to ask several questions. So some of the questions that you should ask are we not doing something? Are we not? So you should also ask whether whether some things that you are doing now should be done. You should also ask whether you are doing something now that you should have done. You should also ask that are you doing something now that you should do, but do it in a different way. You should also ask whether the organization mission and vision is unique in some way. You should also ask, is your mission really relatively enduring? You should also ask whether the mission vision allow you to be more innovative. And also, you should also ask whether your mission and vision allow you to expand. There's several other ones, but I'm sure these are also stated in your book, so I will not go in depth into it. So now I would like to conclude for chapter 5. So basically, we've covered, after reading chapter 5, you should have been able to define the following items, which is some of the key terms here is corporate governing boards, critical success factors, fast mover advantage, liability of newness, mission drift, philanthropy, governing boards, pioneering, strategic goals, values, vision-led approaches. So that kind of covers everything, as well as some of these are the mission statement components that you should also be aware of. So you have the statement components involves target customer clients. We mentioned this earlier: principal, service, and products, geographic domain of operation, commitment to specific values, explicit philosophy, and other important components. So keywords of strategic of mission statements is a residence, living choices, and high quality, caring responses, so commitment to specific values, caring professionals to meet the physical, social, and spiritual needs. So explicit philosophy can be enhancing the quality of life, and other important components can be a timeless environment. So vision statement components is a clear hope for the future, challenging. So, and the key words is leader in long-term care, challenging and excellence. The key words there is secure, safe, and caring. Inspirational and emotional, no keywords. Empowers employees first and clients and customers second. So for patients, their families, and our staff, prepare for the future, quality leaders. And then memorable and provides guidance. The keyword there is quality. So this covers chapter 5. And now have a couple of minutes, think about 5 minutes, to give back and also to take questions if there's any. If you have any questions, please let me know so I can be able to address that. But if not, I would like to close the presentation for today, and then I will post the presentation for your viewing afterwards. Okay, so that's all I have for today. So it's very, very brief. It's just chapter 5. Last week, I think we covered like 3 chapters. So that was a lot to do. Okay, all right. Thank you, everyone. Thank you all for committing this hour. And I look forward to seeing you here again next week, same time. Okay? All right. Thank you so much. All right.